Hey there, Dr. Luke here. Let's go through a shoulder CARS, a controlled articular rotation. And the first thing we need to do is we need to know some of the movements that we're going to use. So we're going to use external rotation and we're going to use internal rotation. So if you can do that with us, external rotation and internal rotation. So what we want to do is breathe in and a radiate, so that we have a really good base for our working joint to work around. So let's do that. Breathing in, a radiate. Now what I want you to do is I want you to abduct and extend and coming up into this position here, externally rotating. And now we'll come to a roadblock here. So we now need to internally rotate. So we start to internally rotate, keeping your elbow nice and straight, extending back, internally rotate, make the biggest circle possible that you can, exploring that outer range, and then we're going to end up here with our palm facing outwards. Now what we want to do is we want to extend back, we'll come to another roadblock, and now we want to start externally rotating. So externally rotated, exploring that range that you have, the best possible outer range that we can go to, keeping your elbow nice and straight, coming back down, externally rotating and end in this position here. Let's do that from side on. So what I'm going to get you to do is breathing in and a radiate. We're going to come up into abduction, come to that roadblock that we talked about, keeping the elbow nice and straight. There's our roadblock, so we internally rotate, extending back, bringing our arm right back, internally rotating, back into this position. Our palm should be facing outwards. Now we go back, extend back, we'll come to a roadblock here. Now we need to start externally rotating, continue to externally rotate, coming forward and up. Great, coming across the body here into external rotation. And there, back to that starting position again. So a few things that I want you to be aware of. You certainly don't want to be moving into any pain or pinching or sharpness. So if you have any pain, just say in this area, what you do is you work around that and explore your best possible range in the pain-free range. So your CARS is not going to look like my CARS, possibly, especially if you do have an injury and you have significant decreased range of motion. But this is going to help improve your mobility, maintain that function, but also give you the information that your nervous system needs to maintain a good healthy joint and spatial awareness. So that's how you do a shoulder CARS.